Hello everyone! I'm Dr. Abigail Chong Rivera. I'm a pediatric infectious disease specialist from the University of the East Ramon Magsaysay Memorial Medical Center and a medical specialist in Rizal Medical Center in Manila. So I'm here to talk to you about some facts regarding COVID-19. So first off, what is SARS-CoV-2 and COVID-19? SARS-CoV-2 is the name of the virus which causes the disease COVID-19 or coronavirus disease 2019. It was named as such because it was first discovered in 2019. Coronaviruses have been with us for such a long time already, but SARS-CoV-2 is a novel coronavirus, meaning it's a new strain of coronavirus, so no one is immune to it. Where did SARS-CoV-2 come from? Currently, the source of SARS-CoV-2 is unknown. The virus most probably originated in bats, the same with SARS-CoV-1, then jumped from an animal reservoir to another animal species. Now, some studies have shown that pangolins, it's a scaly anteater, are the most probable intermediate host, but this has to be yet verified. So the first human case of COVID-19 was reported in Wuhan City in China in December 2019. So at this stage, it is no longer possible to determine how humans in China were initially infected with SARS-CoV-2, but since then, human-to-human transmission has been documented, and the virus has spread in several countries already. So it's very clear that human-to-human transmission is ongoing. So the disease can spread from person to person through small droplets from the nose or the mouth, which are spread when an infected person coughs or sneezes or even just through talking. These droplets land on objects and surfaces around the person, so other people can catch the virus by touching those contaminated surfaces. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who coughs out or exhales droplets. So that is why it's important to stay more than 1 meter or 3 feet away from a person who is sick. What are the symptoms of COVID-19? The most common symptoms of COVID-19 are a fever, a dry cough, and body malaise or tiredness. Some patients may have a headache, muscle or body pains, a runny nose or colds, sore throat or diarrhea. These symptoms are usually mild, so they usually start out mild and begin gradually. But some people who are infected develop severe illness and may develop difficulty of breathing during the second week of illness. And some people who get infected may also not develop any symptoms at all. How is COVID-19 treated? At this time, there are no specific antiviral therapy or vaccines available for COVID-19 according to the World Health Organization, but clinical trials are underway with regards to antiviral therapy and vaccines. But for now, we mainly give supportive therapy such as paracetamol or ibuprofen for fever and oxygen support for those with difficulty of breathing. So what should I do when I've been to a place with local transmission? Stay at home and do self-quarantine for 14 days. So you should stay in a single room with good ventilation, open the windows, and try to limit interactions with other household members. If you do develop symptoms such as a fever, cough, cold, tiredness, please wear a mask. Seek medical consult, so you can call your local government for assistance or try the online helpline if you have mild symptoms. But if you experience difficulty of breathing, go to the nearest hospital for a consult. Now, if you came from abroad and you're not sure if there's local transmission in that particular country, you can go to www.who.int website and look up the situation reports. So those reports have a list of all the countries with local transmission. Should I worry about COVID-19? Now, illness due to COVID-19 infection is generally mild. Okay, 80% of patients who do get infected only have a mild cough, fever, especially for children and young adults. However, it can cause severe illness or serious illness. About 1 in every 5 people who catch it will need hospital care. And around 5 to 6% of cases will become critically ill. So these are the patients who will be needing intubation. Who are at risk for developing severe disease? Older persons and persons with pre-existing medical conditions such as high blood pressure, diabetes, chronic lung or heart disease, and those people with cancer appear to develop serious illness more often than others. Prevention is really very, very important in order to stop the spread of this disease. How can we prevent the spread of COVID-19? Number one, regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. If you do use alcohol, please use 70% isopropyl or ethyl alcohol. Remember, clean hands save lives. Secondly, maintain at least 1 to 2 meters or 3 to 6 feet distance between yourself and anyone who is coughing or sneezing. Remember, you may spread the virus when you cough or sneeze. So if you're too close to that person, you can breathe in the droplets. Next, avoid touching your eyes, nose, and mouth. You don't know if your hands have been contaminated already. So if you keep on touching your face, then you may introduce the virus to your eyes, your nose, and your mouth, and then you may get sick. Next, make sure you and the people around you follow good respiratory hygiene or cough etiquette. So if you cough or sneeze, make sure to cover your mouth and nose with a tissue and then dispose of the tissue afterwards. If you don't have a tissue, you can use your bent elbow when you cough or sneeze. Stay at home if you feel unwell. If you have a fever, cough, and difficulty breathing, seek medical attention and call in advance, and follow the directions of your local health authority. Next, clean and disinfect frequently touched objects and surfaces such as doorknobs, light switches, remote controls, keys, and other surfaces in your house. Use 70% alcohol or household bleach solution. And of course, keep up to date on the latest COVID-19 hotspots or areas with enhanced community quarantine. If possible, avoid traveling to places or going out, especially if you're an older person or you have a pre-existing medical condition, because you're the most at risk for severe disease.